In Look East tonight. Hello, first tonight, are health services under pressure because of the recession?
Figures obtained by Look East show ambulance workers in this region are dealing with a huge increase of what they refer to as psychiatric calls. They can involve anything from an overdose to an attempted suicide. The average number of calls a month between 2007 and 2008 was 700. A year later, that had risen to 900, an increase of 29% in just 12 months. The East of England Ambulance Service believes the rise is linked to financial problems caused by the credit crunch and the recession. This report from Kevin Birch.
Take Suffolk as an example, and here on the front line they're seeing far more calls which are coded as psychiatric. It appears there is a correlation between the climb in the figures and the credit crunch. It's putting an extra strain on the service and their cases, which can prove complex to handle.
A job like that isn't a simple put a bandage on, take to hospital. You know, quite often there's lots of complicated matters that perhaps you may have to sort out on a social basis. Some of the patients I've certainly seen, they have financial worries. Through their financial worries, they've had relationships that have split up, and because of that, they've ended up calling for our services because they have either overdosed or self-harmed.
3, 2, 1, go!
Across the region, health teams are trying hard to nip things in the bud with programmes like this one, which has just opened in mid-Essex. Called Improving Access to Psychological Therapies, it allows GPs to refer patients in days, not months, before things spiral out of control.
As we know, if people are signed off, if they're off for more than 2 or 3 months, it's very hard to get them back into work, and even more so with the recession hitting. And indeed, a lot of the statistics around this project were based before the recession hit. So this is fantastic timing to be able to keep people in work. And we're already doing this, we're achieving this.
Charles Thaker's seen the benefit. He had a heart attack. It led to depression, he couldn't work, and the bills and financial pressure mounted. Getting expert support quickly was vital.
The services they give me is just basically psychological, and that's all I needed, was somebody to help me work things out and feel positive, and that's what they've done.
It's a programme they're planning to expand, saying the feedback so far from service users has been overwhelming. Kevin Birch, BBC Look East.
Well, tomorrow is World Mental Health Day, which is being marked across the region, including at the big screen in Norwich. The TV presenter Trisha Goddard, who's had depression and mental health problems herself, will be taking part. When I spoke to her earlier, I started by asking about the size of the problem.
A number of years ago, the World Bank estimated that by 2020 more people would be debilitated through mental illness than all the other physical illnesses put together. So it has a huge financial impact, social impact, family impact. And, you know, we've been taught to do things to maintain our physical health, you know, eat vegetables, you know, fruit and vegetables, exercise, etc. But the message about what we need to do to maintain our mental health still needs a lot of work to be done.
So when it happened to you, were you aware that it was happening, or did you suddenly think, well, my life is not as good as it should be, I need to go to the doctor, and the doctor told you?
No, I wasn't aware. I thought I was one of those people they call a smiling depressive. I was firing on all cylinders. Bosses love smiling depressives because we tend to work all the shifts under the sun. You work and work and work and work. And it's a lot of men actually suffer from, you know, show up depression in this way. If you work and work and work and work and work, often it's because when you don't work, you feel so empty and dead inside, and you become very isolated, but you can also become very successful. So society encourages you and says, well done, until the day that you cannot do it anymore. And it's like, bam. And I was one of those people.
So you hit a brick wall?
I absolutely hit a brick wall.
When I asked you about mental illness just now, you said this is about mental health.
Yes.
But they are the same thing, aren't they?
No. That's it's like saying if mental illness is when you get ill, and looking after your mental health is like looking after your physical health.
But if you don't look after your mental health, you become mentally ill.
Same if you don't look after your physical health, you become physically ill.
And people can do something about it. That's the message.
Absolutely. Whether they like it or not, people can scowl and go, oh, you know, we know what we have to do for our physical health. It's not too different for mental health. Exercise outside, I hate the word exercise actually, dog walking.
Yes.
I think walking somebody else's dog for them is one of the best things you can do.
Tricia, lovely to see you. Thank you very much.
Thank you, Stuart.
And if you want to find out more about what's happening at the big screen, you can log on to bbc.co.uk/Norfolk.
4 men have been jailed for a total of 32 years after a drive-by shooting in Cambridgeshire. The attack in a peaceful cul-de-sac in Fulbourn was allegedly linked to a drugs feud. Our chief reporter Kim Riley is in our Cambridge newsroom now. Kim.
Susie, during a 10-week trial at Norwich Crown Court, it was described as like a scene from a gangster movie, a family home riddled with bullets. But after deliberating for 3 days, the jury cleared 6 men from the Cambridge area of conspiring to endanger life. But they did find 4 men guilty of a second charge, conspiracy to possess illegal firearms.
One Saturday evening last April, people in this quiet cul-de-sac in Fulbourn heard an explosion of gunfire. A masked gunman was spraying bullets from the back of a motorbike. This semi-detached house was the target, but the family had been tipped off about a threat to their lives and weren't home. The bike sped away. Bullets had damaged gas pipes. The close had to be evacuated. Petra Ben Hafsia has since moved away from Fulbourn. She was in the next-door house with her young children when the bullets flew.
It was something that you never thought would happen in 1,000 years. You could see all the bullet marks across my pavement, across the garden, and going to next door. It was extremely frightening, and I was in shock, really. I was in shock for most of the time.
And you have 2 young children?
I do, and they were at home as well when it happened. They were very frightened. My eldest son was extremely frightened.
This was the weapon said to have caused the mayhem, a Czech automatic assault rifle. 29-year-old Matthew Carpenter, a convicted drug dealer, was sentenced to a total of 15 years for firearms offences and conspiracy to supply cocaine. 21-year-old Marlon Robinson, convicted of the same charges, got 10 years. Also for firearms offences, 3.5-year sentences on 24-year-old Duncan Berry and 25-year-old Eamon Popo from south-east London. 18 months after the attack, people living nearby are wary of speaking out, still shocked by what happened here, fearful of the levels of violence practised in the turf war over drugs.
Well, the judge issued serious crime prevention orders against the 4 men found guilty. It's a new idea, in fact. It's a bit like an ASBO, I'm told, but for serious criminals. The judge said Carpenter was a main man in the Cambridgeshire criminal world. Carpenter, who's already serving a 4-year sentence for drugs offences, then threatened to assault the judge and then assaulted, basically verbally, the reporters in the nearby press bench with 4-letter words. Well, tonight, Cambridgeshire Police made quite clear they're not seeking anyone else in connection with the Fulbourn shooting.
Kim, thank you.